This morning, we continue with the third part of our series on teen mental health. We spoke to the people working in the field, doctors, social workers, psychologists. They shared local barriers to treatment, factors contributing to depression and anxiety, and how we can be better advocates for our children. Here's KQ2's Madam McLean with more.
Suicide is the second leading cause of death in 10 to 24-year-olds. Local children's mental health experts say their plates are full with kids and teens needing help.
We have noticed a consistent flow of families coming in and reaching out.
We have definitely seen a significant increase in the kids and adolescents that are struggling with anxiety and depression. I've had days in the past several weeks where half or more of the patients that I see an entire day have some level of depression and anxiety.
Peacock Pediatrics sees kids struggling as young as 11.
We're even seeing children that aren't even teens yet, having some depression.
Daily Guidance Center, even younger.
We've had some of our itty bitties that are in kindergarten, kind of having some additional stress and worries.
Over the last decade, U.S. health officials say reported cases of depression, anxiety, suicidal ideation increased. What's causing the trend? It may be that more people are asking for help.
I think part of it is more students are willing to admit that they're having some of these thoughts and willing to ask for help with some of these thoughts, which is a good thing.
Some of the issues teens face and that could be contributing to the risk of suicide have always been present.
Between the ages of 10 and the mid-20s, the most active part of the brain is the amygdala, using fancy terms here. That's in charge of emotions. And so young people have really strong emotional reactions to things, and their problem-solving part of their brain isn't as active. And sometimes as adults, we give them mixed messages saying, you think life is hard now, wait until you become an adult, which the stressors may get more difficult, but their brain gets much better at making sense of things.
As well as new stressors. Social media exposes children to unhealthy ideas, images, incessant bullying, things that other generations just didn't experience in the same way.
For example, my generation, we would come home, maybe watch the news, but that was how we were exposed to world events. To me, it seemed like it was far away. Adults were handling it. Our kids, they're exposed to that 24/7. It feels like it's very close to them.
And then there's the pandemic. The Center for Disease Control and Prevention says between April and October of 2020, emergency rooms saw a rise in visits from kids with mental health needs.
The pandemic really threw some gas on that fire, and pretty much every study that's out shows that there's about 25 to 30% increase in mental health issues in young people.
The increase in demand comes at a time when there's less access to care and resources, either because of costs and insurance.
That's an out-of-pocket expense that a lot of people have lost their jobs, trying to get bills paid, and don't have a lot of extra money for counseling.
A shortage of programs and doctors.
In St. Joe and in Buchanan County, there's definitely a shortage for mental health in youth population. It is something we've always faced, but as we have increasing numbers over the last year of the pandemic, it's really become more apparent our needs for additional mental health professionals.
It's hard, like even psychiatrists, a lot of them won't work with children and teens.
Creating long waits.
Sometimes they even shut down wait lists because there's so many people that need to get in.
To ask me to wait for a month or two for an appointment feels like a lifetime. People don't go and seek help when they're just starting to struggle. They wait until they're really struggling. And so asking those individuals to wait a month or two it's too much.
Because of these issues, mental health experts say it's more important now than ever before for you to know the signs. Irritability, changes in eating, sleeping, moods, headaches, belly aches, self-harm. They also recommend making sure your primary care nurse or doctor is annually screening your child.
And if they're not, you either need to ask them to do so or find a different pediatrician. Okay?
One last major recommendation.
Really encouraging parents to listen to their kids and refraining from giving advice. And even asking their kids, hey, do you want me to just listen here or do you want advice from me? And then seeing what their kids say. I ask that question of my kids a lot, and almost always they say, just listen, even though I have fantastic advice.
For those looking for more information on what signs to look for, the CDC has a great resource on its website that allows you to filter the information based on your child's age. Tonight, for our final piece in this series, we sat down with a group of local teens to ask about their mental health and how we can help.